you spoke a little bit about that sense of grounding, in your current role. You chose to come to a single hospital site. So what inspires you to wake up each day to, do the hard work you are doing, especially now?
Yeah, I've worked in healthcare now for 38 years. And this is actually the most difficult time that I can remember. Health human resources have been sort of a cyclical thing in healthcare through my career. There have been times when there were more jobs than anybody could fill. Then there have been times when there were no jobs, for example, for nurses, and they were all going to the United States to work. But we've been in a period now for some time, and I don't foresee that going away. So this time is very challenging for people. So in combination with a pre-existing health human resource challenge, we also have this intense stress of being in a prolonged pandemic. And coupled with, growing demand from population growth, from population aging, and financial constraints, because paying for the pandemic has created huge deficits for government, and healthcare is such a huge expenditure that, it isn't that easy for them to just dump more money into the system in order to help us try to resolve some of these issues. So it's a challenge right now. I think a lot of people are under stress, and I would include me in that. What helps me wake up is to just remember that I can't solve all of these problems, but my job is to try to continue to move the organization forward, continue to try to do what is within my power to be able to resolve issues and to try to ensure that we can provide the safest care possible, and that we can respond to the kinds of patient care demand that comes our way.
In terms of that health human resource shortage that you're seeing right now, how would you describe the issue? Where exactly are you? Is it the front line more so than leadership?
Yeah, so, going into the pandemic, we were starting to see increasing challenges filling particularly registered nurses positions, but also some allied health. Pharmacists have always been a challenging position, for example, to fill. Certain support positions like IT professionals, some of the skilled trades have been challenging. And part of all of those challenges in Ontario, at least, have to do with Bill 124, which is a wage restraint package for public sector employees. But we know that, when I talk to my colleagues across North America, I know that they're struggling with some of the same things, irrespective of wage restraint. And part of that, I think, is that even in my day, although my opportunities as a young woman were certainly much greater than they were in my mother's day, we were still kind of directed to the more traditional fields of nursing and teaching and those kinds of things. I think that women today now, it is a very different climate, and I think they have many, many, many choices. Nursing is still predominantly a female profession, and that's changing, and that's a good thing, because there's certainly no reason why men can't be equally as caring. But I think that just the range of choices that young people have, and maybe even some of their expectations around what they want their work to be. Nursing is a really demanding job. And so is being a physiotherapist, and so is being a social worker, and so is being a physician. And, I think that some people today are sort of pausing and saying, what do I want for my life? And what kind of work-life balance do I want and need? And so I think that's precluded maybe some of the demand that we might have had for people to go into it. I think that the peak of the baby boom and the growth in the aging population, people live longer today. That's a great thing, only it does mean that they need more healthcare, because to live longer means that they're living longer with chronic diseases. And then that means we have to treat those chronic diseases. So instead of dying early at 65 from a heart attack, people are living until 85 and 90, but from 65 to 85, a lot of stuff starts to break down and it's our job to respond. And so that's also generating a lot of pressure in terms of health human resources. So this isn't going away. And then I think the last part of that is that the pandemic has clearly, really exemplified that. The kind of stress that people have been under at the front line over the last 18 months to 2 years has been pretty intense. And so, if you were, for example, a nurse or a physician and you realize, I can retire. I've met my pensionable years. I've got the savings I need to save. Under normal conditions, you might have worked for another couple of years, but under these conditions, you just decide, I think it's time to pack it in. And so we've certainly, the system has experienced that kind of retirement. Some people have just chosen to leave the profession. What that's resulted in is a bit of a disequilibrium around the number of experienced staff to novice staff. And so with so many novice staff in, it means that we have to relook at, how we even staff units. You sometimes have to add staff because you've got people who just aren't as proficient, and it's not their fault. It's just that they're novice. I think we have to relook at training as well and get into more of an applied co-op type of training program for many of these professions so that they do come out more practice ready and more confident. So there's a lot of issues here. It's a complicated issue to resolve. It is a concern though, and it's something that certainly I think keeps many of us up at night.